shocking signs you might already have. Colon cancer. Colorectal cancer is striking an unlikely group, our youth. Recent studies show a sharp increase in cases among individuals under 50. According to a recent report highlighted by NBC News, there has been a significant rise in colorectal cancer rates among the younger population, an age group traditionally not associated with this serious illness. The incidence rates have increased by more than 2% annually over the past decade among individuals aged 20 to 49. This rise contrasts sharply with the rates in older populations, which have generally seen a decline due to better screening. However, young adults, particularly those between 30 and 39 years, have witnessed the highest spike in cases. This alarming trend points to an urgent need for increased awareness and the importance of early detection. Understanding colorectal cancer. Before diving into the symptoms, let's define colorectal cancer. Colorectal cancer encompasses cancers that develop either in the colon or the rectum, sometimes referred to as colon cancer or rectal cancer, depending on their location. This type of cancer generally begins as a small, non-cancerous clump of cells known as a polyp. Over time, some of these polyps can transform into colon cancer. It's crucial to recognize that colorectal cancer is the third most common cancer in the United States, excluding skin cancers. This prevalence underscores the importance of awareness and proactive health checks. Fortunately, the potential for positive outcomes is significantly high with early detection. This fact highlights why understanding and recognizing the early signs of this disease are vital. Now that you know what we're dealing with, let's identify the signs you should never ignore. 1. Changes in bowel habits. When it comes to early warning signs of colorectal cancer, shifts in your bathroom routine are not to be ignored. Persistent diarrhea or constipation, as well as any noticeable change in the consistency of your stool, can be a red flag. Research, as documented on Healthline and supported by studies found on PubMed, highlights that these symptoms, when they persist for more than just a few days, could signal something more serious than a simple stomach upset. If you notice these changes lasting more than a few days, take note. 2. Blood in stool. A sign that's alarming yet often overlooked. This can manifest in various forms, ranging from bright red streaks that suggest bleeding close to the rectum to a very dark, almost tar-like appearance, indicating a potential issue higher up in the digestive tract. Regardless of the shade, the presence of blood in one's stool is not to be taken lightly. While it could be due to something as common as hemorrhoids, it could also be an early indicator of colorectal cancer. This is why seeking medical advice as soon as this symptom is noticed is crucial. Though it might be something benign, it's better to play it safe. 3. Persistent abdominal discomfort. This can include frequent cramps, gas, or pain. These symptoms may seem mundane, but when they persist, they could be pointing toward something more serious, like colorectal cancer. The discomfort occurs because as the tumor grows, it can begin to affect the normal functioning of the digestive system. 4. Unexplained fatigue. This is not just feeling tired after a long day. This kind of fatigue is profound and does not improve with rest. Healthline reports that unexplained fatigue in colorectal cancer may be due to the cancer's impact on the body's ability to generate healthy red blood cells, which are crucial for oxygen transport. The reduction in oxygen levels can leave you feeling perpetually worn out. Oh, before we continue, if you're enjoying the content so far, and if you're new here, make sure to hit that like and subscribe button to stay updated with our latest videos. Thank you. 5. Unexplained weight loss. Losing weight when you are not trying to can be alarming. It's often one of the first signs that the body is dealing with something serious. When it comes to colorectal cancer, this symptom can occur because the cancer affects the body's ability to absorb nutrients properly. 6. Iron deficiency anemia. Anemia in this context generally refers to a decrease in the number of red blood cells, which can result in fatigue, weakness, and pale skin. Research published on PubMed indicates that anemia may be caused by hidden blood loss in the stool, not visible to the naked eye, which is a common yet overlooked symptom of colorectal cancer. 7. Feeling that your bowel does not empty completely. This experience can be rather unsettling. The sensation, often described as tenesmus, is frequently reported by individuals with rectal cancer. Studies from semantic scholars suggest that this symptom, while common in benign conditions like irritable bowel syndrome, should not be ignored as it frequently correlates with colorectal malignancies. Lastly, 8. Unexplained nausea or vomiting sometimes accompanies advanced colorectal cancer. Although these symptoms can be attributed to a multitude of factors, their sudden onset without any apparent cause should raise concerns. According to experts, when nausea or vomiting is paired with other symptoms like abdominal pain or weight loss, it's crucial to consider a comprehensive medical evaluation to rule out the possibility of a tumor obstructing part of the digestive tract. With these signs, your body might be signaling the need for a deeper check. Recognize the symptom? Here's what to do next. If you notice any of the early warning signs of colorectal cancer, such as changes in bowel habits or blood in your stool, it's crucial to consult with a healthcare provider without delay. Early detection can significantly influence the effectiveness of treatment, potentially saving lives. When it comes to the causes of colorectal cancer, it's not just about genetics. Recent studies emphasize the significant role of diet and lifestyle. A diet high in processed foods and low in fiber has been linked to an increased risk of developing this type of cancer. Additionally, sedentary lifestyles may also elevate the risk. Furthermore, while genetics do play a role, with certain genetic conditions increasing the likelihood of colorectal cancer, the surge in cases among younger populations suggests other powerful factors at play. Environmental influences and lifestyle choices are becoming increasingly scrutinized in the medical community. Awareness and prompt action are your best defenses. Knowledge is power, especially when it comes to health. As we wrap up our discussion today, let's quickly recap the 8 early warning signs of colorectal cancer that we've explored. These include changes in bowel habits, blood in the stool, unexplained weight loss, fatigue, feeling that the bowel does not empty completely, abdominal pain or discomfort, a lump in the abdomen, and nausea or vomiting. Recognizing these signs early could be crucial in taking timely action. Understanding these symptoms lays a foundation, but it's equally important to engage in regular screenings. Colorectal cancer, if caught early, can often be treated successfully. The recent rise in cases among younger individuals highlights the need for vigilance at all ages. Don't wait for symptoms to appear if you have a family history or other risk factors. Early detection has shown to be a pivotal factor in improving outcomes, with a 5-year survival rate climbing to 91% if diagnosed at an early stage, compared to 14% at an advanced stage. These statistics underscore the importance of targeted screening programs and increased awareness among younger populations. If you got any value out of today's video, then please do us a favor and like the video, share, and subscribe to our channel. Turn on bell notifications so you never miss a new video. That could help improve your health and the health of those you care about. Speaking of videos that could improve your health, here is one on the screen for you to watch. Just hit play.